I have signed so many of these in high school.
Well, didn't you know that abstinence promises break easier than condoms do?
To delay the onset of sexual intercourse and to protect our youth against pregnancy and HIV and STD transmission, comprehensive sex education should be used to spread awareness on the benefits of positive sexual health. So, what exactly should comprehensive sex education look like?
There is a hidden epidemic sweeping our nation. Do any of you guys know what this epidemic could be?
Chlamydia is the most common bacterial STD in the United States, affecting 1 in 15 females ages 14 to 19. Genital herpes affects 1 in 6 individuals in the U.S. HPV affects nearly all sexually active men and women at some point in their lives, and HIV disproportionately affects African Americans and the MSM population. STDs are common and need to be talked about. It is evident education is needed to protect our nation's health.
Sexually transmitted infections are on the rise, and they're transmitted through sexual contact. Throughout this course, we'll be focusing on HIV and STD risk prevention by learning about transmission, prevention, seeking treatment, getting partners to treatment, and recognizing your symptoms. Additionally, we will learn about the importance of choosing partners wisely, contraceptive methods, and practice skills to enhance our sexual health and decision making.
After many lessons of basic introduction to healthy relationship building and sexual decision-making, STDs were discussed in the classroom. In this excerpt, HIV and AIDS were explained to the class.
So now that we've discussed one of the viral STDs, HIV, let's hold a brief discussion. Now, could someone give me a brief overview of how HIV is transmitted and how it develops?
HIV is transmitted through the exchange of 4 body fluids. These fluids include vaginal fluids, semen, blood, and breast milk. Some people think that it can be transmitted through urine and saliva, even though this is not true.
Well, it can be actually very hard to recognize if one has HIV. The acute infection occurs within 2 to 4 weeks, which is called acute retroviral syndrome. In the next stage, clinical latency, there may not be any symptoms as the virus progresses. However, when AIDS develops, your body is most vulnerable at this point because your CD4 count is below 200.
Okay, so even though it's common for there to be no symptoms, what are some of the possible symptoms that you could have after you've been exposed to HIV?
You could have fever, enlarged lymph nodes, sore throat, or even a rash.
Now, who can tell me what you should do if you think you may have HIV or if you've had unprotected sex?
There are so many tests available. For example, you could get tested for free at community organizations or could have a test completed at a doctor's office. Oral swab tests such as OraQuick are available and blood tests are available for confirmation. The next thing to do would be encourage your partner to get tested.
And also, what's a good way to bring up testing to your partner?
You can support your partner by encouraging both of you to go in for testing together. You could also let them know that it is important for their health and think that it should be a good step in your relationship.
So since we've learned about the different bacterial and viral STIs, we should also learn how we can prevent these things from occurring.
The risk of STD transmission can be significantly reduced through the use of condoms. In order to effectively use condoms, it is essential for students to practice the use of them in the classroom.
We've also discussed different methods of birth control and barrier methods. I've demonstrated how to put a condom on. Let's work in small groups practicing putting on a condom.
Check the expiration date, check for visible damage, check for near pocket, and push the condom to one corner. So now I can just open the condom,
Yeah.
slide it out, and I need to check to make sure that it's rolling the right way.
Right.
Okay, so now that it's rolling the right way, I should squeeze the tip,
Exactly.
place the condom on,
And then roll it down.
and roll it all the way to the base.
Yes.
Smoothing out any air bubbles in the process.
Correct.
Now, Kim, could you help remind me how I remove the condom?
Yeah, he should withdraw before he loses his erection.
Okay.
And then you hold the condom at the base and then roll it down.
Okay.
Careful not to spill any of the semen inside.
Right.
And then once the condom's off, you tie a knot in it and throw it.
Condoms are very effective in helping reduce transmission of STIs, such as gonorrhea and chlamydia. However, HPV and herpes can still be transmitted due to skin-to-skin contact.
Could someone help me understand the difference between herpes and HPV better?
I actually can. Herpes is a virus that manifests itself in two different ways, HSV1 and HSV2. HSV1 usually occurs orally and HSV2 usually prefers the genitals, but they can also present opposite of that. So HSV2 can occur orally and HSV1 can be on the genitals. Blisters can occur with itching, tingling, and burning, but usually those go away within 8 to 10 days, and you can be put on medication to help treat that. While it can't be cured, it can be managed. In fact, about 1 out of 6 people have genital HSV2.
So what about HPV?
HPV is a virus that hardly ever has symptoms, so it's very important for females to get tested with a pap smear for abnormal cells. There is currently no test for men with HPV. HPV may cause cervical cancer as well as genital warts, and if left untreated, can cause PID. You may have been confusing the warts with the blisters from herpes.
Be an advocate. Support comprehensive sex education.
We do!